I've been fascinated by your book. I mean, becoming a parent is crazy. It's first your whole life changes around, and then you're responsible for this human being that is so vulnerable, and you have to make like 1,000 decisions, which can be very overwhelming. Which is really cool when you have a little guide. I know every child is different, but it's I'm really excited to talk to you, especially being a dad.
Yeah, I think it's a tougher time to be a parent than ever because there's so much information out there and all the decisions seem like they're so big at the time. And so I think it's very stressful to be a parent right now, and it's very difficult to know what to do.
Yeah. And especially when you're in a system where in America, compared to Austria, where I'm from, everything is about profit. And in every business. So every company, they're just trying to make more and more money. And unfortunately, in the whole health system, it's become a little bit like that too. So you always got to watch over your shoulder.
I don't think it's a little bit like that.
Yeah.
I think it's a lot like that.
Yeah.
I think that it's really important that all of us, especially parents, we realize that medicine, healthcare, it's run by profits these days. I mean, that's what it is. It's not to say that doctors are bad people. They're of course not. These are great people. Pediatricians are going into medicine to take care of kids. But at the end of the day, the country is in a significant way run by corporations. And so their incentive is not to keep us healthy. That's a nice byproduct sometimes if you have a product, but it's really about making more money for your shareholders. And as long as we recognize that, then I think we can move in a better direction. But it's not about evil companies. It's about us not pushing back on what's going on and realizing that a medication is not the cure for everything. It can be great sometimes to have a medication, and it can certainly help heal you in the short term. It can be a great band-aid. It can be something that can be very beneficial, but the root cause of most chronic conditions are not going to be fixed or cured by a pill. It's changing our lifestyle and realizing that there are so many things that we're doing that are leading to these chronic conditions. And even in kids now, I mean, 50% of kids have a chronic disease, and it should not be that way.
This episode is sponsored by Plant Paper, tree-free, toxin-free toilet paper, because otherwise you're gonna put this cancer up your butthole. And I think you should care because this literally goes inside of you. Yeah. I mean, this is even more intense than the skin. The skin is already really bad.
Yeah, even more for our ladies. I mean, you do not want this paper touching your yoni. I mean, it's going so deep in your yoni.
What? Are you crazy?
Yeah, so, and I know it's hard, and you really have to start. I think
it's not hard. It's not hard. Just get Plant Paper today. And if you use the code CandyCan, you get 25% off your first order. Go to plantpaper.us right now and get yours. Yeah, it's taken a crazy turn. Especially, I mean, when I look at the classroom of my 3-year-old, everybody has allergies. Autism is a huge topic. It's not like that anymore. When I was a kid, it was very different. I got vaccinated, of course, but it was the amount of vaccinations was very different. I'm born 1992, and yeah, it was a very different thing. And now the amount of vaccinations and the amount of Tylenol and I mean, you name it.
Everything. It's just so much more, and not everything is bad in medicine. I mean, some things are great that we can, get an antibiotic and it can cure your pneumonia and can get you back to life really fast, and that's great. But we're over-prescribing basically everything at this point, and that's the only thing that is in a doctor's toolbox. It's the only thing that we're doing. We're quick to give a medication, and we're forgetting about the side effects. We're forgetting about how that affects our kids and ourselves. And that's a big part of what's going on. And it's not okay. We need to be talking about it more, but it just seems like as soon as you start the conversation, everybody gets angry and nobody wants to talk about anything. And you talk about autism rates going up, and it's like, oh no, it's just better genetic, and it's just genetics. Oh, it's just that we're better at diagnosing it. And it's like, it didn't go from 1 in 25,000 to 1 in 22 in a few decades just because we're better at diagnosis. I mean, that certainly is true. We are, but I don't remember almost any of these conditions when we were growing up. Certainly they were around, but now, just like you said, you go into any classroom and a whole bunch of kids have peanut allergies, a whole bunch of kids have asthma, a whole bunch of kids have mental health concerns, a whole bunch of kids have prediabetes, a whole bunch of kids have autism or some sort of developmental disorder. How did we get here? That's not normal.
So what do you think?
Well, I think that it's, to me, well, first of all, I want to take a step back. And the first problem with this is that we don't actually know, right? I think that at this point, the big issue is that we keep trying to step back and just say, oh, it's just normal. This is just what's happening. I mean, that's where the news and the media seems to be going these days, and trying to take the emphasis off of anything that we're doing and just say that it's the genetics, it's just happening more. We're just better at diagnosis. And that's not true. We need to be figuring out exactly what's going on. I think we need a roadmap for parents and for ourselves of like, here are the top 10 things that are happening that are contributing to these conditions, and these are the things that we need to do to change that, whether that's in in their family or whether that's bigger things that we need to do in society. And it doesn't seem like we're doing that at all. And to me, the biggest two factors are diet and toxins. I feel like the food that we are eating is extraordinarily crappy these days. Even in the best case scenario, we're not getting the nutrients that we need. We're not getting fresh food. Our kids are mostly eating ultra processed crap and sugar. I mean, that's 70 to 90% of most kids' diets now are ultra processed foods. So they're not getting the nutrients. And then you add to that all the chemicals and the preservatives that are in the food and also just in our lives in general. And how do you expect their body to function? How do you expect them not to have a chronic disease if they're bombarded with chemicals and we're not providing them the nutrients that they need to function at their best?
Absolutely. And also I feel like when I look, I see it always hits the uneducated and the more unfortunate families that are struggling with their jobs, don't have the time to, like you said, make a nutritious meal or go to Erewhon and get the best organic meals for their kids. So it kind of like hits the poor and the uneducated the most, because they just don't know any better, and they're so busy with their life that their kids get left behind.
They do, and it's also not as available. I mean, there are just so many locations around, and if we're just talking about America, there are so many locations where it's very hard to get fresh produce, and even if you could, it's very expensive, much more than fast, cheaper food. And just like you said, the education might not be there, but also just the time factor. I mean, there just isn't enough time for certain families and certain family structures to really spend a lot of time cooking or going to the grocery store or cooking every single day. And that's a big societal problem. It's something we need to change. But I think on a family level, at least recognizing that there is a lot that we can do can help parents to make a difference and maybe to try to prioritize health a little bit more, because our society has really prioritized faster, cheaper as the thing that's better, and what we lose with faster and cheaper is health. I mean, we don't focus on the ingredients, we don't focus on the quality, and we focus on, oh, this is cheaper, this has a pretty picture on the box, and that's fine, I guess, some of the time. But based on what's going on, I mean, we have to recognize that this isn't okay, and our kids are inflamed and they're struggling, and it's time to do something about that.
Is that what motivated you to write the book?
It's one of the big topics. So there are two really big things that made me want to write the book. Number one was the first thing that we talked about. The stress levels in parents, I think, are higher than ever. And I really wanted to write a book that ran through all the big things that I talk about every single day to help parents have some sort of guide of the things that are going to be coming up, and then also to help parents think through a lot of these questions that come up, because it really feels like parents don't trust their inner gut anymore, especially because there's just so much information out there. And grandma tells them one thing, and then they read the influencer who says something completely different, and then they read a book, says something different, then they ask their pediatrician, says another thing, and it's like, okay, which one do I do? And we've just forgotten, I think, to some degree, that we have to trust our inner gut. We have to synthesize this information and then figure out for ourselves what is best for our family and our kids, and then try that. And there is no specific one right answer for everybody. There almost never is when it comes to parenting. And when you step back and you take that approach to answering these questions, it de-stresses you a lot because you realize that there isn't necessarily one right way to do it. Even in your own family, you might have 2 kids and one child, the first thing's going to work for, and the second child, another thing is going to work for. Like maybe you need to, you want to start your first food at 6 months for one baby and you want to start at 8 months for the other baby because they're not ready. I mean, these things are not universal. And I think that can help de-stress parents. So that's number 1. Then number 2 is setting the foundations for health, because the chronic disease rate is really higher than ever. And it's, as a pediatrician and as a dad, I want to see change. And to me, the way to do that is to get to parents before the issues happen. I think that's what medicine was always based on, was prevention and discussion and teaching. And a lot of it now seems to be telling people what to do and catching things after and then treating them as opposed to preventing them. And that's why I wanted to start from day 1, talking to parents who are pregnant or have young children so they can set the foundations to build healthy, resilient kids as opposed to coming at it after the fact.
Would you say that, so you said, I think I read that it's really important that you educate the parents so that you don't make the decisions for them, but they will make their decisions for their child. Mm-hmm. But when it comes to education, sometimes I struggle with finding the right source, because, like, let's say vaccines is very suppressed, like on YouTube or on other social media platforms. They might take a lot of ad revenue from pharmaceuticals, which might not, it's not very likely that they would want a very critical view on vaccinations on their platform, which then gives you only one narrative. And like you said, maybe your grandma has a different opinion, but then you go online and everybody says something else. So sometimes I struggle with finding the truth, because it's so suppressed, because America is one of the only countries that take ad revenue from pharmaceuticals.
Sure. Well, I mean, I think that's a very tough question, because it kind of depends on the question that you're asking. I think that there are many things that you can get some good research, and you can get at least you can get different perspectives or opinions if you go to trusted resources or you use the guidelines of the trusted bodies. I think at the end of the day, at least that information is good knowledge. That way you can synthesize that in. Like if you're talking about, sleep training or when to potty train or using screen time, like there is good information out there, and anybody who tells you their one way is the only way, I think I would go the other direction in general. But at least you can take in the different perspectives. If you're talking about I don't know, feeding, like baby-led weaning versus purees, it's good to know about both. But at the end of the day, then you have to take that information in from the best resources you can find, which is sometimes it's hard to know what that is, and then synthesize it to what you feel like is going to be best for your family, and then implement it and see if it works. But yeah, it is very hard on some of these topics to really know. And then if you're talking about something like vaccines, I mean, that's the most controversial topic there is for whatever reason. And I'm just so frustrated by it as a pediatrician and as a dad that we can't talk about this more. It's like there is, I think, no topic that's suppressed more or creates more division or creates more fighting online than vaccines. It's like if you post anything, either somebody writes in, oh, it's the vaccines that did it and they're the only cause and that's the problem for everything in the world. That's one side. Or the other side, it's like anything that you talk about in any even remotely negative light or ask a question about it gets suppressed, it gets shut down. And we all want healthy kids, right? I think everybody wants that at the end of the day. And we might not all agree about how to get there, but if we aren't able to have debates and discussions on every topic, including vaccines, then I really feel like we're doing our children a disservice. And I don't know why all of a sudden in society we've just started trusting companies to give us the best information and all the correct information. And that's obviously not going to be the case. They want to create a product that you're going to buy the most. They want to show it in the best light, and they want to decrease any negatives of that thing, whatever it is, whether it's a medication, whether it's a shot, whatever it is. And that doesn't seem like what's happening now. And I hope, and that's one of the reasons why I'm trying to talk about it more, is I really think that we need to discuss it more, have open discussions and debates, so that way people can feel more comfortable with whatever decision they're going to make, whether it's from shots or anything in medicine. And that's why hesitancy for everything in healthcare is the highest it's ever been, because people don't trust the healthcare system anymore because they feel like There's a lot that's not being discussed, or people are being told what to do instead of providing the best information that we have, discussing it, and letting parents decide what's right for them. And that's what we do with almost everything in medicine. It's not, the name literally doctor is docere in Latin, which is to teach, right? That's what it comes from. And yet all of a sudden in the last few years, it's like, do this or you can't be my practice. This is the one right way. This is the only way. We have all the information. We know exactly what the right information is for everybody. Just do it. And that's never true for anything. Science is always evolving. We're always learning. And I think that at the end of the day, again, we're all on the same team, right? We're on the same team. And so we need to continue to question everything so that way we can get better research and better data and protect our kids the best we possibly can with whatever that means. Whatever that means at the end of the day. If that means we have to change up ingredients, if it means we have to change up a schedule, add something, take away something, I don't know what the right answer is, but we won't know unless we ask the question, discuss it, and then study it.
Why does my pediatrician tell me the vaccines are safe and they don't educate me on what's in the vaccines?
So the research that we have is the research that we have, right? Mm-hmm. So that is, I think, the biggest issue when it comes to a lot of stuff in medicine is the research we have comes from companies, and it's...
Is it true that they don't do studies on vaccinated and unvaccinated?
There haven't been double-blind controlled trials for almost anything on that, because the theory is that that's problematic, because then you're not giving kids a product which they should be getting, so therefore they don't feel it's ethical. So that's the reason why it hasn't been done, as far as I know.
But what if you get parents that don't want to vaccinate?
So that could theoretically be done, but then it wouldn't be the best kind of study, because the people that might not want to do the intervention, whether it's a medication, they could be different than the people that do want to do it. So then there could be some bias, and you can still do the study, but it's not a perfect study because it's not randomized, right? So you have let's say you have a bunch of people that don't want to do medication, and they're all hippies, right? And so their whole life is different. They're eating different food, whatever the reason is, right? But you can have the reason that you find something could be because they're eating healthy food versus not because of the medication. Yeah. So that's where the issue comes in. It could still be done, and it should be done. I think it should be done. I don't see why we shouldn't be doing any kind of study that people want to do to see what we can find to make things the healthiest they could possibly be. There's no downside, in my opinion, to that, other than to the companies who we might find something. But maybe you won't. Maybe you won't find anything, and then people will be more inclined to do whatever the product is because you do a double-blind control trial and shows, look, we did this, we did it on 1 million people, and the people that took our product are actually healthier. That's what a science is supposed to be, right? That's what a research study is supposed to be. So I don't know what the end result is, but the reason that we have the information that we have is because that's the data, and the boards and the panels that have looked at this have decided that things seem safe and they're working well, and so this is what we recommend, and we want to protect from disease X, Y, and Z, and that's what they recommend, and most doctors will follow what is discussed, and that's what the general recommendations are.
But the statement is false, no? That the vaccination is safe.
Well, I couldn't say that it's false per se. I mean, it depends how you define it.
Yeah, if they spend millions of dollars to shove parents up that had side effects, and if they have crazy ingredients that they don't tell you about, and there's no trials that really show, and there's not really any stats on the vaccine, then I don't know.
So I know what you're saying, and I agree with you in part, but I think the wording matters, because what really should be said is, if you believe that something is safe, then you should be saying to your patient, as far as we know, based on the research and data, we have found the risks to be better than the benefits to be better than the risks, right? That's like the real way to say, because everything, no matter what, has some risks, right? So safety, I mean, you can't, if you're the one kid that has an allergic reaction to something, it's not safe for you, right? That doesn't mean that the product hasn't been tested and hasn't been shown to have a level of safety that's considered safe by the bodies, right? Like if let's just talk about Tylenol, because that's easier, right? If you're talking about Tylenol, like it can be unsafe if you take too much of it. It can be unsafe in the wrong person. Someone can be allergic to it, but you would consider it in general safe because the bodies that be have decided that there is a level of benefit that way outweighs the risks to most people. And based on the research and data, the benefits outweigh the risks, so therefore we call it safe and you can use it. Now, to say that something has long-term safety or doesn't have any risk for you, well, it's not exactly the right way that things should be said. I think it's more, marketing or just easier to say it that way. But a lot of medical products...
Maybe it's the wording.
I think it's the wording, because I think, even when we're talking about the newer products that are coming out and the things that have happened in the last couple of years, it's ridiculous to say something is safe long-term if it hasn't been studied long-term. So you can't say that. You could say, based on what we know so far, seems like the benefits outweigh the risks. We have minimal risks. Here's what they are. And so there's, 0.1% chance this could happen, 0.1% chance that this happened. There's a, risks that maybe we just don't know, some things we haven't seen, and we can't tell you what's long-term because it hasn't been 10 years. We don't know if you're going to grow a fourth arm because, it hasn't been 10 years. It's possible, right? I mean, anything is possible down the road, but you have to go with the information that you know. And I think that there's a lot of push to just kind of do things and not have discussions. And again, it's like, this is a reasonable, open discussion about this. Not to say you should or shouldn't do something, but the reality of not being honest is creating problems for a lot of people because they're having a lot of hesitancy because it's very obvious when you say something is safe long-term that hasn't been studied long-term, that doesn't make any sense. And then why would you trust anything else that person says? So I think it's a matter of discussion, and I think it's a matter of honesty, and I feel like people don't feel like they're getting told all the information to at this point, and that's why I have said I do want to talk about it a little bit more, because I think it's important that we do, so that whatever questions parents have can be answered. And there may very well be answers to some things, and we might be like, oh, this isn't safe, and then they could be like, well, we've done studies on 10 million people. Look, it is shown to be safe. Like, that's what we should be having. So if you don't believe in something, then the science should be able to back it up.
Yeah, I just wish my pediatrician would be like a little more neutral. Like, I don't expect them to be like telling me all the side effects right off the bat, but there could be like I don't know, they're very pushy, especially with babies. The last time we went in, they were like, you're gonna put your baby at risk if you don't do this. And it's very pushy. It's not that you should consider this vaccine. It's more like, no, if you don't take this vaccine, you're putting your baby at risk.
I think vaccines and medications are foundational to the doctor. We're trained in it, we're taught in it, and so most practitioners very strongly believe in these things, and they feel like it's their duty to make sure that people are getting the things that are protecting their children. And, if you look at the research, most of the research does show that for vaccines, there's a lot of benefit to taking vaccines in terms of protection from diseases, right? I mean, you can argue that different things and different diseases, but at the end of the day, there are lots of studied benefits for these things, and they believe in them. Now, the appropriate thing to do, I think, is to have a discussion about the risks and the benefits, explain to the families why you feel like this is the best thing for their child, and then let them make the decision that's best for them, which in general in medicine, if you're with a doctor, usually you trust that doctor. If they have an opinion on something, they say you should do this for your kid, you're probably going to trust them to do that. And that's what I think most people do. But I don't think it's good to kind of bully or make people feel ashamed or not be able to ask questions. And that does happen sometimes in medicine too. And just like you said, there are a lot of practitioners in healthcare that have very specific beliefs and don't want to work with anyone that doesn't have those beliefs. And I think that's everybody's right to do that, but I just don't think that's the best way to practice medicine. I think the best way to practice medicine is if you believe something, you should work to prove that to other people, so that way you can convince them to do the thing that you think they should do based on the science and the research, not based on because you think it's the best thing.
Sure. When I eat something, it shows me exactly what's in. There's like labels. Mm-hmm. Should there be labels on vaccines?
There are. Usually you don't see them. But
why do you not see them?
Most offices have them there. So, like, for example, there's usually the sheets, which has all the information. Might be on the website, might be in the room. When you buy a box of them, let's say you get a box of whatever shot, polio shot, it's in there. Like, there is a sheet of all the stuff. Most parents don't see it because they don't want to read through it and look at the long sheet. But it's there technically. I just think that it's a practicality thing of, most people are not going to read it, don't actually care, and the doctor doesn't want to spend 15 more minutes talking about it because they only have so much time. So it exists if you want it. You can certainly ask. People have asked me for sure before. For the inserts, we have them in the room, and we have them in the actual boxes if somebody wants to take one home. And you can also Google it if you want to. They all exist. But I think that in general, the greater point that you're getting to is that most people don't actually realize what's in these things and don't realize the long list of ingredients in them. And that is something that probably should be more discussed. But again, I think if it's more discussed, then that's not what the companies would want, right? They want you to just kind of do it and not think about it because they're a company. And realistically, from our perspective, I think the best thing that we should be doing as a society is looking at these things, discussing them, studying them, and figuring out like, oh, is there an ingredient in here that maybe could be triggering some reaction? Maybe there's something we could change to make the shots better. Maybe there's something we could do to, if you find like, oh, this ingredient is related to eczema, maybe we take that ingredient out and put something else in so we could decrease the risk for kids. I mean, there's no downside to that. That's not controversial, but for whatever reason, we can't have that discussion. And it's like, we should want to do whatever is best for our long-term kids' health and discuss that.
Why is there mercury in most vaccines?
There's not mercury in most vaccines. So that there used to be mercury in vaccines. They took that out of vaccines a while ago. The only one that has thimerosal is the multi-dose flu shot. So that's the only one that still has a mercury type component. It's not in the rest. And the reason that they have the metals, I mean, you're probably more talking about aluminum then because that's what's in most of the shots these days. It is an adjuvant that helps to stimulate the immune response to make them work better. So that's the reason why they're in there, technically.
Why do they give hepatitis B to newborns?
So I have always, of all the shots, that's the one to me that I have more questions than others about. First of all, the biggest risk for hepatitis B is if mom has it and passes it to baby, then you have the most significant risk of serious complications. Now, that is something that was put into place many years ago. We have much better testing now. So there is a lot of debate, even in not in the out there woo-woo kind of anti-world of like discussions of whether that is something that makes a lot of sense for young babies. I mean, it's technically possible you could get hepatitis B by banging into a needle or, getting drops of blood on them, but I don't know that that's ever actually occurred or has a very high risk. I mean, it's there. It's a theoretical risk. It's not a huge risk. And so these days we have testing, and a lot of people do choose to decline that younger on because the risk is very small from getting it. But the recommendations are the recommendations. I don't make them. And I think that is a really good question that should be discussed more because it does make sense to me, in my personal opinion, that's a discussion that should be had, that if parents are tested and they don't have hepatitis, then there should be some discussions around the pros and cons of doing it then versus later, which to me seems reasonable for a newborn baby to have a discussion around that, since you want to balance the risks versus benefits.
What about the vitamin K and the eye cream?
So the eye cream, so antibiotic eye cream, that's for prevention of chlamydia and gonorrhea passage from mom to baby. So again, similarly.
Yeah, which is, how likely is it that...
It's very unlikely if you don't have it. I mean, there's, I guess, no chance if you don't have it. The risk would be that the test was wrong and you actually did have it, or maybe you got tested and then got it after you did the testing or something like that. So there's a risk again. But if you don't have it, then you're not passing it to your baby, so there's no risk for them to have it. So that, again, is one of those things where I do have discussions with families who talked to me before about their personal risks, because if you do have it, then yeah, it's probably reasonable to do it. You don't want your baby to get chlamydia in the eye, right? So that's not a good thing. So it's a reasonable, it's great that we have these things, but you need to have that discussion with them. Vitamin K, so...
But wait, doesn't the mother get tested for STDs?
Correct.
But then my wife got tested and then still got the eye cream.
So that's what I'm saying. So it's recommended for everybody, so they don't miss one. But if you, as a parent, want to discuss this with your practitioner and you have been tested and are negative, then there is really no risk for the baby unless the test was wrong or unless you did the test a couple of weeks before, and then you got it after that for some reason. So if you know that you don't have it, then there isn't really a risk to a baby. So that's where you should have the discussion if you want to with your practitioner to say, well, I don't feel like there's a risk to my baby. Do I really need to do this? And then you can make a decision that's right for you. You don't have to do anything. Or you don't have to do anything. It's just that these are the recommendations and these are the things that doctors would recommend based on the guidelines. But you as a person can speak to your doctors and
But they don't ask you.
They should.
They didn't ask me. They just did the eye cream and nobody told me why and nobody told me if or what I can do. And especially as a first-time parent, you have no idea about your, you never get educated in the school system about your law or your rights or if I can walk out of the hospital or not, what I can say to a doctor,
Right. I mean, there's not a lot of education on that kind of stuff because in general, the guidelines are the guidelines, the way that things are run are kind of, it's like a factory, right, in a hospital for good and bad. I mean, they do things kind of A, then B, then C, then D. They want to make sure they get everything correct. They want to make sure they do everything for your baby. They want to protect you as much as they can. But that's where...
But do they? Or do they just want to use as many products on you as possible?
I think that for the most part that most practitioners are good people and they want to do what they feel like is best or what they're trained is best. I don't think that in general a nurse or doctor is doing more products because they want to make more money or do more. They're not generally, if you're working in a hospital, getting paid any more or less, depending on what you do. You're getting paid a salary. So I really don't think that most practitioners have any sort of nefarious or doing anything because they want to give you more products or anything like that. They're doing what they think is best or what the guidelines state is best based on what has been studied and researched and the best information that's available now. So I don't think they're doing it because they want to give you more products. But I do think that it's unfortunate that you don't have discussions with them. You should be aware. And that's one of the reasons why I wrote the book, because I think you should be aware of these things. I don't think that I should be telling you what to do because I shouldn't be telling you what to do. You should be aware that these are the things that you're going to be offered so you can research them and decide if it makes sense for you. Because if you are going to be offered the antibiotic ointment and you have chlamydia, that you should get it, right? That you should be aware of that. You should make sure that they give it to you, right? And as opposed to the other side of it, where if you don't have it and you don't want it and you want to minimize the medications that are used on your child, you should be aware this is happening so you can discuss and politely decline it. And that's the way that all healthcare should be. I mean, it should be discussed, and there shouldn't be a patient who comes back after and says, "Oh, I didn't even know they were doing it, and they just did it, and they just gave my kid a medicine." Like, that's not correct. That's not appropriate medicine. And that's not what we want to be doing anyways, because then that fosters distrust for the next time where, maybe there is something that you should be doing. And then you say, I don't want to do anything because I don't trust anybody in healthcare anymore. Right. And then that's what I think is happening a little bit, because I think that I see in my office, I see people that say, I used to do X, Y, and Z, and now I don't want to do anything anymore because I don't trust healthcare at all. And that's also bad because we're supposed to be on the same team. And there are things that we know that can be very helpful for families. And if you don't access care, then things can get worse. So you really need practitioners that you can trust and that you can have discussions with so you can ask these questions. Because if you had the discussion at the hospital, then maybe you would have said, okay, I do want to do it. Or you would have said, well, I don't think we need that. Let's not do that. Maybe let's do the vitamin K. That's okay. And then you would feel much more comfortable and you would have minimized the medications that your child received. And maybe that's a good thing. Right? Maybe that's a good thing long term because you've minimized one medicine that your kid had they didn't need. Because antibiotics have good and bad. I mean, one little amount of antibiotics in the eye is probably not the end of the world, but it's still something. Still could have potential side effects, and it's still one thing that a newborn's having to deal with. And why would we do that if the benefits don't outweigh the risks? Right? That's what we should be looking at for all these decisions, is not that there isn't going to be a risk, but what are those risks actually? And then if we're doing this, does it actually outweigh it? Because if you prevent 1 in 100 million kids from getting an eye issue, but you give 1 in 50 kids some other eye issue because you give the medication, then you shouldn't give the medication, right? Like, that's the thing that we have to do. But if you're saving 1 out of 10 kids and 1 out of 1,000 kids gets a reaction, well, then maybe the thing is better to do. But we have to have that lens, I think. And that would be much more appropriate. And I think people would trust a lot more, because you're not saying that there aren't any risks. Like, if you give an antibiotic, there's a risk you could get diarrhea, right? You can get antibiotics, you get diarrhea, but if you have the stomach virus and you're going to get dehydrated and die, I'll take a little diarrhea instead of dying. So it's a balance.
Yeah, I think I just wished I had more of a choice where I experienced the hospital being very one way, and you really, like you said, you have to speak up and ask questions all the time over everything, because otherwise they'll just do it.
Right.
Nobody asked me about if I want it or not. I didn't even know there is a choice. There was no choice. When we were there, they were just young parents. We're going to do this. And nobody asks you about your opinion or how you want to do things, and you don't even know you have a choice. I think most people don't know, or even most people don't even know that you can have a home birth, or you don't have to, like you said, take the vitamin K and the eye cream and what the eye cream is for. So you're not being educated. And that's why it's so important for young parents or upcoming parents to take control and read books and educate themselves as much as possible.
I couldn't agree more. And that's why I'm trying to speak about these things, because I think it's important to have the discussion so that way you know, because the alternative might be that you just say, well, I'm going to do nothing. And for example, like vitamin K, right? It's a great example. That could be very beneficial for your child. Usually when we have discussions prenatally with parents, if people are going to do one thing, they usually choose to do vitamin K because there is a real risk of bleeding for kids. Vitamin K helps with clotting, and when you're first born, you don't have a lot of vitamin K, and so there's a risk. It used to be about like 1 in 10,000, I think, is the number, vitamin K deficient bleeding, and if it happens to be in your brain or in your gut, then that obviously is very severe, and you won't usually catch it right away, and so it could have very severe consequences. And so that's why they introduced the vitamin K shot, which basically takes that risk down to zero. But there's also an oral vitamin K, and this is a good thing to know too. So if you want to do something in the middle, then there is the oral vitamin K, which decreases your risk, but not as much as getting the shot. And again, the risk of the bleeding is not very high. It's 1 in however many thousand, 10,000, but it's there, and it's very severe if it happens. So that's a good thing to know, because maybe you have a very traumatic birth, and maybe there's a lot of bruising, and so it is reasonable to do that, even if you didn't want to. But that's a good thing to know before about what it is and why you're doing it, so that way you can be educated before going in. So, not all medicine is bad. It's just that I think where we are in terms of our education is a problem, and there's a lot that we can do better to really be a team player with patients, especially in the hospital. I mean, I know that hospitals kind of run as a corporate sort of machine, but that is where a lot of people access healthcare, and that's very much machine-like for a lot of people, and especially in the birth process. I think more than anywhere, it's very dehumanizing. I hear that a lot from families. It's very much like A equals B equals C, and a lot of people, like I said, don't even know they could do a home birth, and a lot of the discussion around home birth is, it's so dangerous. Why would you ever do that? And the reality, if you look at all of the research, is that home birth with a trained midwife in a scenario where the risk is very low going in, it has actually a much lower risk of complications, and people do better, right? So I think that's well known. If you have complications during your birth, if you're high risk, then the home birth is not in general the place to do the birth, because they have a much higher risk. But for a young, healthy couple who have no known complications, almost all the research shows that a home birth is safer and the risks are lower. So these are not things that are ever discussed with anybody, and you should know your options. It might not be for you. I mean, you may want the hospital, and that's fine. And I think for birth, medicine's come a long way. A lot of moms used to die, a lot of babies used to die, and we have a much lower rate of death for both of those these days. So it's not all bad, but we have moved so far one direction, so far into the medical world, and we're so out of balance. And I think that we need to move back a little bit and find a nice zone in the middle where we're not throwing away all of medicine. Like, it's a good thing we have MRIs, it's a good thing we have X-rays, it's a good thing we have antibiotics, but we just don't need to use those as much.
Wasn't there like a crazy Austrian that came up with the grabbing them at one foot and shaking them that they cry? Have you heard about this?
I have heard of the shaking the babies to cry, but I don't know about that specifically. I think, maybe.
They used to do that, and then they kind of stopped.
It's probably good.
Man, so these families that come to you, what would you say is the biggest problem for young parents or for parents with problems that come to you?
So the biggest like concern, or
no, what do you deal with mostly when as a pediatrician practicing?
I mean, these days, the main thing you're doing is the checkups. So I think the majority of your day is doing wellness checks, talking about development, making sure that kids are growing, making sure that their exam is normal, their vision is good, they're getting their dental care. I mean, I think that's one of the big things. And then if you're talking about, the other aspect, then it's dealing with sick kids, all the regular stuff, coughs, colds, runny noses, rashes. And unfortunately, these days, more and more, we're seeing chronic diseases. So we're seeing more autoimmune conditions, autism, ADHD, mental health concerns, allergies, eczema, you name it. We see it. I have I think, special practice in that the patients are a little bit self-selecting, so they're probably a lot more health conscious in general, and so I don't see nearly as much of that as I used to. When I worked in the hospital, we'd be giving out medications like candy. I knew all the dosages off by heart. Now I barely ever have to do it, so I don't have to look up everything now because I don't, use antibiotics very often. Not never, but just not that often. So. We're seeing everything, and we're seeing things younger, and that again is still very unfortunate.
I think I saw a case where you mentioned that somebody had autism and then they got rid of autism with lifestyle changes, or how does that work?
Yes. So I mean, this happens a lot actually, and there are many practitioners, especially integrative practitioners, that are working with children with autism diagnosis, and they, depending on what they do, but their lifestyle changes in general, and the kids lose their diagnosis over years. I mean, I've seen it in my practice. I've worked with people that have seen it, and I was part of Documenting Hope, which, so I didn't have anything to do with the actual research, but I'm part of that organization that did the research, and they just published this year in Journal of Personalized Medicine about two 20-month-old twins that they were following for 3 years and had very high-level autism when they first saw them. And over those few years, worked on their diet, worked on their sleep, worked with integrative practitioners, changed up their lifestyle, and they lost that diagnosis. The symptoms went from high to basically very low over just a few years of changing up their lifestyle. And I think that's an important message to get out there, because it's not what you hear very often. You just hear that it's genetic, or it's just we're better at diagnosis. And I think that really needs to be discussed more, because I do believe that there is a significant portion of what we call autism that is actually a lifestyle disease, a diagnosis based on toxins and other things that we're doing in society that have created inflammation in the brain that we call autism. Because there's no magical test to say that you have autism. I mean, you're going to a practitioner, they're doing a bunch of asking a bunch of questions and watching the child and then giving them the diagnosis. So it's not so easy that they're just like, oh, you have this gene, you have autism. But I think it's probably many things. I think that there are some kids that it's very highly genetic, and then there are other kids that it's very highly environmental. And I think that a lot more of it is actually environmental. And if we were to discuss it in that way and kind of break it up, then we could be doing more for these kids. And I don't know why we wouldn't want to do that. I mean, if you're completely happy with the way that everything is in your home, that's great. But there are a lot of families that have children with autism that have very severe symptoms that are nonverbal, that have repetitive motions, that harm themselves, that it's a very difficult time. And why wouldn't we want to work with those kids to try to help them with their symptoms as much as we can? I mean, I don't see any downside to that. It's not controversial. I don't know why it is, but everybody wants to say no. You shouldn't talk about that. We shouldn't have that, and it's crazy to me. I mean, these are kids that are struggling and family that are struggling, and we should do what we can to help them if we can, and whatever we can do. I mean, there's no downside to working on our diet and working on getting them moving more. I mean, that's going to be helpful regardless of anything. But if there are a bunch of kids that we can help them to get back to a place where they're functioning more optimally and they're happier and their parents are happier, then why not do that? How is that controversial?
Are there some things we could generalize? Like, there's no kid that should be eating processed food.
That's correct. I mean, not at least a lot of it, right? I'm not an all or none type of person, and so.
But with processed food,
I don't think we should eat it. Yes, but I think that just saying in general, I'm not an all or none person, so I don't think that parents should be super terrified if their kid goes to a party someday and has a piece of cake or whatever. But I think at the end of the day, we don't need it. I mean, we should get rid of it, or it should be. We should work towards minimizing that as much as possible because most kids are eating 70 to 90%, and realistically, they need real food. So in an ideal world, sure, we get rid of it all. It's not going anywhere for a while. So I think as a parent, we have to make those decisions, and we don't buy it for our own home. We don't feed it to them at home, and that's going to get you most of the way there. But yeah, I think if you're going to generalize the big ones, is food. Too much sugar, processed foods, too many chemicals, not moving enough, too much screen time. Not sleeping well enough, way too stressed. Those are the big ones, I think.
What about is it fair to say that the amount of vaccines is ridiculous? At least the amount?
I don't know that I could say it's ridiculous, but it's more than it ever was. And I think that it's...
How many? It's like 55 by the age of 10 or?
It depends. So it's hard to give that answer because it kind of depends on what you consider to be a vaccine. But if you're components of a vaccine plus all the flu shots plus all the
every needle that goes
there's a lot of needles. So you can say 50 to 70 in that range, depending on what you're considering. So it's a lot. I mean, the argument on the other side is, well, then you're protecting kids from more things in theory, right? So it's that's the balance that you need to have. But I agree with the generalized point that you're making that it's a lot, and we're not having discussions around. Okay, there are many vaccines that we're giving kids. Do we need to discuss this on a greater sense? Do we need to study these in combination? Do we need to look at how or if these things are doing anything to our kids long term when you're doing 10, 20, 30, 40, 60, 90? They're going to have 10 more shots. They're going to have 300. Where is the end game? When are we going to discuss it? More is not always better, right? Can be. More of some things can be better, but more of some things can be worse. And when you're talking about any sort of chemical, let's say lead, right? You don't want your kid to have any lead, but they touch a little bit of lead, they'll be fine. You drink a whole bottle of lead, you're going to die, right? So it's there's an amount that matters, and the more of anything that we're doing, the more risk there might be, and that is a reasonable discussion that a reasonable parent and a reasonable concern that parents would and should have. And I don't know the answer to it because you can't know the answer unless it's studied. So the only way...
they're not allowing.
Right. Sorry. Yeah, they're not... There isn't the long-term studies that people are really looking for, and it's a very difficult thing to do. It costs a lot of money, but it's something that I believe is in everybody's best interest, and something that I don't know whether the government or some independent, it has to be some sort of independent body that's funded somehow outside of the pharmaceutical companies can kind of monitor these big companies. I think that's the only way. You can't expect a company to do the best research against their own products. That's ridiculous, right? So they're not going to do that, right? So they're not going to tell you why their product is a problem. I mean, look at not just that, but look at all the other chemicals out there. How many years and how many lawsuits does it take to get, for us to be aware of glyphosate? How many years and how many lawsuits does it take to be aware of, PFAS, forever chemicals? It's even when they know, you have to sue them for 20 years, and then everybody finally is aware of it, and they've moved on to some other chemical anyways. They don't care. They know. So it's up to us to step back and say, well, we don't trust you at all. We should not. Let's study these things ourselves, and let's see what the true data is. And maybe the true data is the benefits outweigh the risks, and therefore we can show you that. Where is that controversial? If that's truly what's going on, then why not do that? And if there are risks that we should be aware of, then shouldn't we all be aware of that so we can make decisions based on that?
Should there be any child in front of a screen from 1 to 3?
Well, so the recommendation is 0 screen time between 0 and 2. There's not over 2. It's 1 hour. Is the recommendation, no more than that? I think the bigger question really is when we're in front of a screen, what are we not doing? So we're not outside. We're not playing. We're not educating our kids ourselves or reading to them. So the screen inherently, in my opinion, is not terrible. Screens are here to stay, and you can learn from a screen. You can. But plopping your kid in front of a screen is not the best way to parent, I think, in the long run. If you need to go to the bathroom, if you are on a long trip, I'm not super worried about those kind of things. I think parents shouldn't be super stressed about that. I get questions sometimes, families with 2 kids, and the older one's watching a screen, and the baby turned and was watching it for a couple of minutes, and they didn't realize, and now they're all stressed because they think their baby's brain's turning too much. That's not what I'm worried about at all. Your brain's not turning too much if you're watching screens. It's just that if you're on the screens a lot, you're not doing other things. And the average teenager is on screens for 7 hours a day now. It's very high. And can you do your homework on screens? Sure. Can you learn on screens? Absolutely. But are you losing something in your life when you're on the screen 7 hours a day? Of course we have to be. We're not outside, we're not moving, and that can't be good for our health. So I think it's a balance, and we need to find somewhere in the middle where we're using technology but not relying on it so much that it's our whole day.
What do you do when your toddler cries every day?
I guess it depends on the reason, right? I think that, they're for younger kids and toddlers and babies, they do cry a lot. So I think there's a reasonableness to expect what's going on, but it kind of depends on the reason. I think we're trying to figure out why that might be going on. Is there something going on medically? I think that would be the first thing that we're thinking. If there's really nothing going on medically, then is it colic? Is it tantrums? Is it outside of what's normal? How many hours is it going on for? Most kids do cry a little bit, so that's not necessarily concerning. But I think if it seems like it's outside of the normal, then you would talk to your practitioners about it, and you would try to figure out what might be some of the triggers, and then try to work towards minimizing those triggers so they can be a little bit more supported. So you're kind of preventing some of the crying from happening if you can figure out what the triggers are.
What would be a good age for you to educate your child on what's really going on in the world? Like, when do you tell your child that the doctor doesn't have your health in interest, or that pharmaceuticals are just making profit? My parents never did, but I wish they would at some point.
Well, I think that it's something that is a gradual process. You kind of got to know your kid too, because some kids, you don't want to scare them too much. I think that's a bad thing too, and you don't want them to know too much. So I don't think there's an exact answer to that, but I think you need to know your child and know the level of what they understand and how they can comprehend. And of course, the older they get, the more that you can talk to them about it. And certainly as they're getting on into the older ages, teen years, I think it's important to help them to be more aware of what's out there, be more aware of taking health into their own hands, and explaining it to them why, so they can kind of form their own opinions and use that as they go forward. For younger kids, I think that we don't want to give them too much information, but I don't think it's ever too young to start teaching them about health. I think as soon as they start learning and as soon as they start eating, you can teach them about healthy foods versus not healthy foods, foods that make them not feel so good. Oh, we don't eat this food because it won't make you feel good. This food will make you sick. That kind of stuff, we already do it with our 5-year-old. So he's well aware of healthy versus unhealthy. He doesn't know about all this stuff. Maybe he hears us talk about it sometimes, but I don't think he has a good grasp on that. But he's certainly going to know it before he gets out in the world. And I think that there's, you have a long transition period between 2 years old and 18 years old before they're off on their own or whatever. So I think it's a gradual increase in terms of information. And again, knowing your own kid, I think, matters too, because some kids, you can have that conversation with them much younger and it's not going to scare them. But other kids, if you start telling them all the horrible things going on in the world in the news, they're going to just be terrified at all times, and that's not good either.
Do you remember when your turning point was in your life, where you lost a little bit of that being naive in the medical system or into the educational system or food or nutrition?
I think it's been several things. Starting with my training, going through and seeing people getting better outside of the system, and starting to wonder, why is somebody going to a naturopathic doctor and getting better from a thing that they were told they were going to have for life? That was one thing. Meeting my now wife, around that time, she's also very holistic minded, so that opened up my eyes too. And the last few years, watching everything during the pandemic, I think that also opened up my eyes a lot because we actually got to live through something new and kind of see things being brought out and the way that pharmaceuticals worked and the way that things were interacting. And so I think that was another big eye-opening experience for a lot of people when it comes to the way that healthcare is run. And I even think over the last few years, just seeing the suppression of some information and kind of sides being taken in the news, which is weird to me that which kind of news left or right there is when you're watching the news, which seems very counterintuitive. The news should just be the news, and you're just getting your information. But just watching sides kind of take shape and then sitting here as a healthcare practitioner where kids are just kids. There's no sides. There are no sides. Like you should be able to talk about anything and be on any sort of platform. And watching that even not being the case for me, and to some degree where some things wouldn't have me on, just because I had opinion of people should have make their own choices, or we should be able to have discussions around things, and that was too much already. And so I think that a lot of that was like, okay, well, if that's the way that's going to be, then I guess I just should say what I think, and that's fine, and we'll just go from there. And if people don't like it, too bad, And I think like those kinds of progressions over the years where I think, a lot was suppressed. I think it's a lot better now than it was a couple years ago. It's still not great, but I think it's much better, and a lot more platforms have opened up to allow people to have discussions like this, which I think are needed and what is going to actually change healthcare and what's going to make it better and what's going to actually make us healthier, because we're never going to get there if stuff is suppressed. We're never going to have healthier kids if we trust companies. It's not going to happen. It has to be people having discussions, good scientists, good practitioners who care and say, hey, I'm curious about this. Let's study it. Like that's how we're going to get to a better place, because that's what science is. Science is not, here's the answer, that's what it is. Like that's not true of anything. We keep studying stuff. So I don't know. I think that's where we need to go, and it's where I hope we go. But it's been a slow, kind of gradual process of things getting so bad that I think it kind of turned the corner, and now there's a lot more open debate and discussion, which is great. And I would say most of the bigger platforms at this point are really having open discussion. So it's like, if some of the other platforms don't want to have it, that's fine. But people want to talk about this stuff, and that's why I feel more comfortable in talking about it, because I think it's important. Like there's no reason we shouldn't have a discussion about all the topics and all the things that you ask me, and very little of it is actually controversial. It's just, let's talk about it so we can help our kids be healthy. And because I don't know all the answers, right? I'm not some magical doctor that knows all the answers to everything. And even if we're having a discussion and you ask me a question about a vaccine, it's like, I don't know the answer to your question because we haven't studied it appropriately. We need to.
When you were studying, is there a narrative or certain things that they push upon you where you like get directed a certain way to not question certain things, or is there things that are just off topic and cannot be touched? Like what you said, like there's so much controversy in medicine and in science that people don't want to go there, like especially with vaccines or COVID or autism. There's just so many topics that it's like you can't really go there. Because you have to be like afraid even to lose like your medical license, and when you ask too many questions.
I hope not. But I mean, I guess, that's always the thought in the discussion. But when you're going through
it's scary,
A little bit. I mean, a little bit, but whatever.
I mean, even as a creator, you have to know, like, if you're too critical about certain things, then YouTube will be like, no, we don't want this here. Right. Let's take your monetization away. You're spreading misinformation. So or you can't be political.
It's insane. I mean, all that stuff is just insanity, but it is what it is, and we're kind of living in that world. It's getting better. As I said, I think it's getting better, and a lot of platforms are actually doing a little less of the censorship now, but still all there. And I think the people that are creators are usually savvy to what the topic of the month is that's kind of being censored. But when you're going through training, to your question, I don't think you're really thinking about it. I think that you are learning what you're learning, and it's not like there's some discussion about how, shots are this way and don't talk about it in any different way, or autism is that. You just learn what you're taught, And I think a lot of the teaching comes from what's been done before and what's come out of pharmaceuticals. So it's not nefarious in any way. It's just that's what you learn and that's what you know. And unless you're open-minded, or unless you continue to do your research, or unless you get outside of the bubble, you don't hear the other perspectives. And so that's your perspective. And that's not that somebody's a bad person. It's just you just don't know anything different. And if you're trained, antibiotics are the right thing for this, for your ear infection, then that's what you're going to do. And unless somebody says antibiotics are bad because of this, this, and this, and you should do this other thing, then you're a doctor, you're trained to give antibiotics, that's what you do. And that's what I think is true of most other things in terms of the actual medical profession. Then when you talk about, online social media, I think that's bigger. I think there are other things at play that kind of shape the narrative, whether that's companies that want to make sure their products don't have issues, or whatever it is. I don't know. There's always different things for different discussions, but social media is a new world of suppression that I don't know that anybody was ever really ready for, and it's a weird world that doesn't have a lot of obvious answers, and certainly it's odd to go through what we went through the last few years, where debate was really squashed on very specific topics, and it's just so crazy because that's not how medicine works. It's not how science works. It's not how anything has ever worked before, and it just kind of happened. And I guess in good news, it's moved backwards a little bit, and people recognize it and they talk about it a lot more, and a lot of other platforms popped up to have discussions. So hopefully, the world balances and we are moving back in that direction a little bit, and hopefully it continues in that direction. And the more that people talk about things, the more that it becomes okay to talk about it, because oftentimes when something's suppressed, there's a reason for it. Once it gets discussed, and everyone's like, oh, well, I see what they were saying. And then it's not controversial anymore. They're like, oh, okay, I guess, that does have a side effect. Oh, I guess, we shouldn't spray glyphosate on everything. We've had a lot of lawsuits. It's like, it just takes time, but they try to suppress it for as long as they can, I guess. But yeah, I don't think doctors are bad people. Like, I never say they're not. It's not about that. It's not about talking poorly about anybody. It's just the system is what the system is. And unless you get outside of it, and unless you have an open perspective on things, then you just know what you know. And I hope that the more discussion that is had, the more that practitioners are going to say, we're doing this, let's study it a little more. And then I do think that if you were like, hey, this product has these side effects and this is a huge risk and we should change up this and that, then the most doctors would. I think they would. I think it's just you need the evidence to show them. And it's very hard to get that evidence. It's very expensive. And who's doing it?
I don't think doctors are bad. I think, the system is very hard on them, because also they gotta cover themselves a little bit, and they don't want to get sued. And and if you only have like you said, I don't know, 7 to 15 minutes. I had the other moment. My son had ear pain. I bring him to my pediatrician. She looks inside. I guess it's inflamed, and she prescribes antibiotics. But she doesn't give me any options, or she doesn't really talk about it with me. And me and my wife decided to not take the antibiotics. And we did some natural remedies, and it got better. But of course, if I was thinking about it, then what is her incentive? Does she get paid more to write antibiotics? Probably not. But
no.
But if, let's say something crazy happens and she said
Correct.
You don't need the antibiotics, I will come back to her and blame her for it, right?
So that is correct. So that, I think, is a big problem with American medicine, is covering your butt and suing. Yeah. Right? I think that is a huge part of what has pushed medications, not in a bad way. So the first part of what you said, is the doctor giving you medication because they're getting paid more? Absolutely not. You definitely don't have, it has nothing to do with that. And you're not getting paid any more because, that's the pharmacy and that's your insurance plan. It has nothing to do with us. But do you go to urgent care and they give you a prescription almost no matter what because they want to make sure that they give you something? Yes, because in a litigious world, what you would lose for in a case, in theory, is if you didn't follow the standard of care or you were negligent. And so if the ear, kind of looks okay, right? Let's say you went in, and let's say you went to urgent care, and the ear looked okay, And maybe it's a little ear infection, maybe it's viral, maybe it's bacterial. You probably don't need anything 99 out of 100 times. It's going to be fine. But your kid happens to be the one where it's some crazy infection and the eardrum burst and now they have hearing problems later and they didn't even give you an antibiotic, and then you go back 2 or 3 years later and you sue them for that and they say, well, you didn't give them antibiotics and you should have, right? So that creates a defensive style of practice where you say, okay, well, I'll give you the antibiotics just in case, because that way, if anything happens, at least you were treated, and you're not going to be able to sue me because I did the treatment that I was supposed to do, which is not the best thing for the child, because the best thing for the child in that scenario would be, this is minor, you probably don't need antibiotics, treat it like it's viral, support the body. If it gets worse, get checked again, and then we can consider doing the medication at that point, or give it a day or two and then maybe do it. But that's not how a lot of medicine is practiced, because it's practiced defensively. So I think it's important for parents to know that, so that way they can understand to advocate for their child. And in the book, I talk about that specifically, like how do you get the most out of your visits? And in those kind of scenarios, the only thing you really have to do is ask questions. You just have to feel empowered to take that extra minute. If somebody's giving you a prescription, to say, okay, I just have a question. What are we treating? Why are we doing this medication? Do we need it? And then you give the doctor a chance to say, well, I think it's pneumonia and it's bacterial and I think it's this. So therefore, you do need to take this antibiotic because it's going to get more serious or it's not going to get better. Or you have a urine infection with this kind of bacteria. You need this antibiotic or it's going to get much worse. It's going to get in your kidneys. Okay, good reason to take an antibiotic. Versus, well, I'm not really sure. It's probably viral, but you can take this antibiotic if you want to. But do I need to take it right now? Well, you probably can hold off for a day or two and see if it gets better. And if it doesn't get better, then fill the prescription. That's what most doctors will say if you ask them, because that's the actual correct way to perform medicine, especially with ear infections. And most of the time, it does get better on its own. So if you are empowered to ask that question, you can go that next step, because a lot of doctors think that you want something. They think that you want a prescription. And if you are a parent that doesn't want the prescription unless you absolutely need it, then you have to kind of let them know that and kind of give them the opening to say, well, you can hold on this and wait another day or two, or they'll say you need to take it. I mean, that's the discussion to be had. But the key there is to feel empowered for your child, to not just trust that the initial discussion is everything, because a lot of times they just want to get in and out as fast as you can. I see a little ear inflammation, antibiotic, and you're good, when 90+% of the time, probably 99% of the time, you don't actually need an antibiotic. It's just a virus and it's going to get better. And an antibiotic has zero benefit for a virus. It just has side effects. So there is no benefit, only risk. So you shouldn't do it for those kind of scenarios, except if it's a bacterial infection that antibiotic covers. So that's the discussion to be had. And the extra minute can save your child a round of antibiotics. And that matters. I mean, we don't talk about it enough, but it matters. It absolutely does. We know that at this point. The research shows that you have an increased risk of almost every chronic condition if your child's had one round of antibiotics in the first 6 months. Not a huge difference, but it's there. So it doesn't mean that you shouldn't take antibiotics if you need it. It doesn't mean that you should be terrified if your child ever had antibiotics. But it does mean that we should recognize that antibiotics have potential side effects and not just do it just because.
Especially when it's not necessary.
Correct. Well, that's what I'm saying. When it's not necessary, we shouldn't just do an antibiotic just because we're like, well, just in case, all right, because I don't want to get sued. That's for the doctor. That's not for your child. For your child, you should take an antibiotic if it's going to heal them from a bacterial infection to which they might have serious complications from. You shouldn't take it because it might be bacteria, it might be a virus, it might get better, because I've seen it personally. I very rarely need to give antibiotics and kids do just fine. You don't need to once you step back. But most of medicine is done in that defensive way, like you mentioned, and so it's just given out. Like I can imagine that if you were to look at an urgent care's records and look at ear pain and see how many kids that went into urgent care for ear pain left with an antibiotic, it's probably like almost zero, right? When we know that over 90% of ear pain is viral. So you can just look at that kind of statistic. I don't know the statistics, but I'm just guessing because I've never had a kid that came back to my office that went to urgent care for ear pain and wasn't on an antibiotic. So that's just how it is. So you have to know that as a parent so you can advocate for your kid.
Man, so how crazy is it then that you get that as a newborn the antibiotic on the eyes.
Right. Well, that's where I go back to kind of that initial discussion, more circular, where it's like, again, it's not benign. And so this is something where I do believe it's really important that I hope we go back and have further discussions in modern medicine to talk about, is this really necessary, or is this something we can offer for those that truly do need it, as opposed to recommending it to everybody? And that discussion should be had. And if that discussion's had and it's ultimately decided that the benefits outweigh the risks, so be it. But I looking from here, it just doesn't make a lot of sense to me, in my personal opinion, that if you've tested somebody and they're negative, then you should just give them an antibiotic just because we have the research to show that it has side effects and complications, and we know that. So we need to balance, well, one course of antibiotics increases your risk of almost every chronic condition versus you basically have no risk of this thing, so let's just give it everybody just because. Well, that's a bad weight calculation for anybody who's stepping back and looking at that. So I think if we were to really have a discussion and open debate about that, it would probably have a lot of people that would be like, I don't know, maybe we don't need to give that to everybody. Maybe we just have that available for everybody and they can decide if they want to do it. And we say, well, here's what it's for. Do you want to do it? There's a 0.00 whatever risk that you're going to get this thing. Do you want to take that risk, or do you want to take the antibiotic or not? And I think most people wouldn't do it if that was presented that way. Some would, but not everybody would. And that would be appropriate informed consent.
Right, instead of mandatory.
Right, exactly. Well, it's not mandatory. It's just recommended. But I think.
But if they do it without asking you,
correct. But it's not mandatory, I guess, is the wording again. It's just
done anyways.
They did it without appropriately asking you for your opinion, right? Does that make sense?
Consent.
No, they didn't get your consent to do it. It's not that it's a requirement. It's just that their directions are, you follow these 10 things when you come to the hospital. We're going to do all these things unless you opt out of it. But they should be informing you of any medication they give you, so you can say, yeah, I do want to do that. Yeah, I want to do that. Okay, I don't have a problem with that. So if you didn't know, then that would be, I would say, at least somewhat inappropriate.
Yeah, it just seems crazy to me, because then you might as well give everybody antibiotics at birth. Right.
Right. Well, we don't do that, right?
Yeah, exactly.
We don't just give people medications just because, in theory. I mean, that's what that's common sense.
And that really, but things like that really makes you not trust the whole system anymore. It's really sad, because there is so much great benefit to medicine. There's so much great benefit to doctors. I mean, everybody wants an ambulance when they get in a crazy accident, but then there's so much dishonesty. They kind of ruin it. Because they don't give you at least a choice, Well,
that's my literal point when we were talking about some of this stuff earlier, is there's such a huge distrust in healthcare and medicine right now. And that's because the discussions like we had are not being had. And if you were to have them, people would trust medicine again. Like, doctors used to be the most trustworthy people, I mean, maybe other than firemen. And now I bet you if you did a study, they wouldn't even be on the list anymore. And people just don't trust that establishment anymore, because they're not having open, honest discussions. It's not debated. It's not online. It's not anywhere. And you have a whole section of highly, highly intelligent, articulate individuals who, kind of, I think, so busy kind of doing their thing in modern medicine. And it's really important in the long run that I think doctors step back, kind of team up, look at everything that's going on, and engage in open debate and discussion about any questions that parents or patients might have, so that way people can feel more comfortable doing all these things. Because if you did, then maybe they would change their mind. Maybe they would say, like, here are the 10 reasons why we should do the antibiotic IOMIT no matter what. And maybe they would give you really good data on it, and you'd be like, oh, okay, I guess that's a good reason. The risk is pretty small, and that's a good benefit. But unless that's done, unless I could see that and you could see that, then why should we trust to just do something just because? And that's not happening right now. And so there's this huge distrust. And I'd say very bad thing, because, like the boy who cried wolf scenario, it's like something's going to happen in the next 10 or 20 or 50 years where we do need medicine, and people are going to be like, I don't want to listen to these doctors. They're crazy. And then like Ebola is going to go everywhere or something. It's like we might need something one day. You might need some medication. And if you don't trust the establishment, then, you might get really sick, and when you should have taken some medication. I don't know, right? That's what I think is going to happen if we continue in this direction.
Is there information about the percentage of that actually need to be circumcised? versus the ones that do it anyway?
So need, I would say you don't need to do a circumcision.
Ever?
There's no evidence that you need to do it.
Ever?
No, never.
So they mutilate little boys, millions of little boys every day.
So
Every year.
It's a very interesting discussion because circumcision to me, I did not ever think it was so controversial until I started talking about it. And there are, many people out there that are very concerned and kind of have those concerns that you have. There are not really medical reasons to do it. So when you really look into the research, there's a little bit of a decreased risk of urine infections, but not anything major or significant, and urine infections are not significant. So the medical reasons are not there. The only reason to do it would be because you choose to do it because of cultural beliefs. Some cultures do it because dad has it and you want to do it also.
But you're a newborn. You have no...
So the baby doesn't get consent, and that's the flip side of the argument to why you shouldn't do it. So right now it's like 60-40. It's slowing. So it was more before and it's continuously going down. So it's still more people do it than don't. But it's been progressively declining over the years. And this is one of those subjects where for me it's personal choice. If people want to do it, they do it. If they don't want to do it, they don't want to do it. But there's not a medical reason to do it.
But if I cut out any other body part of my baby, I go to jail.
Correct.
Right. Imagine cutting anything else off, like a finger.
It's a weird line that we've drawn, but that's something that's been done culturally for many years. So I think that's the reason why it's been drawn in that way. The procedure is pretty minimal, but it's still surgery.
Have you seen the contraction that they go in?
Yeah, I've seen it in the hospital. I haven't. I don't know if it's
minimal.
It's minimal compared to other things, but nothing is minimal. And this is a discussion I have, whether you're talking about tongue ties, circumcisions, everything, it's still a procedure. There's always risks, in terms of the scale of procedures that we see, the risks are pretty minimal compared to other things, but the benefits are not really there. There's no such thing as really the benefits of doing it. So it's really a personal choice and a decision that somebody would make for whatever reason that they have. So, it's not my job to tell people what to do or not to do. It's my job to give them the information on it. And the answer and the discussion in the book, if you'd see it, is, there's no medical reason to do it. It's up to you if you want to, and some people do and some people don't. But it seems like the trend is to do it less and less.
Dang. Yeah. I always thought there was some crazy thing that needs it. But it's really nice to hear that there's no evidence at all.
No, there's no evidence. I would say, as a pediatrician, if there are definitely more issues you would see from kids that are uncircumcised because stuff gets underneath there. You can get irritation in between the skin. So you see a little bit more like in terms of irritation and infections, but that's still very rare and not necessarily a reason to do it. So medically, even in terms of the guidelines from the American Academy of Pediatrics, the recommendation isn't to do it. It's just that there's not a medical reason to do it. It's kind of their take on it. So I think that the science world, I guess, it would be in agreement that there's not a good medical benefit to do it, then it's just more you choosing to do it for whatever reasons you have.
What ages do you have in your practice?
In my practice, birth till around 18. You can go a little longer, but around 18.
So you deal with gender abnormality and everything that's going on with the gender discussion right now?
Sometimes, not so much in our practice. That's more in like an endocrine practice. But we see everything. We're in LA, so there's all sorts of whatever beliefs families have, whatever family structures you can imagine or discuss. We've all seen it all, whether it's in the hospital or in the practice. But
you don't prescribe hormone blockers.
No.
What do you think about that?
I think that, as a practitioner, I have to respect all patients' beliefs and kind of not put my own beliefs in front of theirs. And so we don't do it in the practice. I don't do it, but, people will do whatever they decide is best for their own kids. And that's, the most that I can really say on that topic. It's a tough topic.
Why don't you do it?
Why don't I do it? Because I'm not trained in it, and I don't have anything to do with that.
I don't think anybody's trained in it.
Endocrine doctors are to some degree, but it's like more of a newer, the amount of usage of hormone blockers is obviously a lot higher than it used to be, but it's been used for a long time, but for mostly other reasons in the past.
But how weird is it that you can't drive a car or have a tattoo, but you can change your gender, no?
I think, it's something that it's a bigger discussion. And I think that, to me, I have to be respectful to my patients and not put my beliefs above anybody else's. And so I think at the end of the day, people have to do whatever they think is right. And I think it's a newer issue that's going to be continuing to be discussed a lot more.
It's scary. Are you worried at all about putting your kids in school?
I am worried about putting my kids in school. I'm worried about...
there's nutrition, education.
Yeah, I think that
so much.
There is a lot that's going on with education these days that is not ideal. I think that especially even just from a nutrition perspective, I think that's easiest. One of the biggest concerns in patients in my office is kids that, in schools that, you look at the food and it's terrible. And so you just don't want your kids to eat there, and you have to trust that they're going to eat well, but that's very difficult. I mean, it's hard to know sometimes what they're teaching them. It's not always things that people are very comfortable with them learning. The amount of exercise that they're getting is very unfortunate these days. It just seems like it's going down and down and down. So I think there's just a lot of reasons why the education system is not where we would love for it to be. And I think that's hopefully something that's going to change in the long run, but it seems like it's going in a worse direction at the moment. So yes, I think it's a big concern, and something I'm still not sure what I'm doing.
Right. Becoming a parent is a big shift in your life.
Mm-hmm. It really is, and I think it's very weird because when we were growing up, the homeschooled kid was the weird one. And now, it seems like it's the opposite. The kids that are homeschooled are way seemingly more adapted and more worldly and educated more in terms of like they're farther ahead. And so I think that's a weird world. But then at the same time, you don't want your kid to be deprived of being around other kids and other things. So I think there's some middle ground there. But I mean, the rate of kids homeschooling is skyrocketing. And I think that's because of what we're seeing to some degree. But I don't know. I hope it does shift back. And again, I think that a lot of stuff is, well, not everything, but some things are shifting back a little bit more. And so I hope that by the time that I have to make these decisions later on, that we will see things improved somewhat to where I feel more comfortable with it. But at least for right now, I'm not sending them.
Never ever?
Not never, just not right now.
Yeah.
I don't think that I wanted them to be homeschooled for like the long run, but at least for the first couple of years, I think is totally fine. And even for our own child, I mean, we do very little every day, but he's already finished a lot of grade 2, and he's not even in kindergarten yet. Like, they just do a couple pages of a book a day, and they just kind of roam through because you're not waiting for the other kids, so it's a little easier to do it. But we'll see. We'll put him in at some point. But I haven't decided yet. I don't know. It's an answer to be continued.
Yeah. Sometimes I feel like even the first one is a little bit more, you try to figure things out. And then with the second one, it's a little bit, you kind of know what direction you want to go a little bit more.
Yeah, but it also depends on their personality too, because there are some kids that are very, that would do better in school and other kids that would do just fine at home. So like for us, our first one's very social. So I'm not worried about his social skills. So I'm not too worried that he's not going to be in school. I mean, we'll create stuff that he's in with other kids and pods and things like that. But eventually, you probably will want to do school. I don't know. I mean, we're moving in another direction, even for school. I mean, a lot of people are like, I don't care to go to college anymore. I can make more money doing other things. I could have invested in real estate 20 years ago and I wouldn't have to work anymore. It's like, it's a different world now. So I think that we'll see where things go in 5 or 10 years. But at least for right now, I'm not like super keen on sending them to school.
So if parents come to you and they don't want to get vaccinated, what do you do with them?
We don't force anybody to do anything in our practice. So we just have discussions around everything, and then people come to whatever decision is best for them.
So you would make them aware of the risk?
Well, we talk about the benefits and the risks. The benefits, potentially the risks of not doing whatever, if you're not getting a medication, why? And what are the risks of those things? And then they would choose to do what they would do.
Okay. And what would be the bad about not getting any vaccinations?
Well, the big, obviously theoretical risk would be that you would not have the protection from the shot that it would be provided. And if there was an outbreak of whatever, you happen to be the kid that got it, then you could have, you could die from the disease, you could have pneumonia, you could go to the hospital, whatever it would be. I mean, there are measles outbreaks and kids get sick, flu, people die from the flu every year. So, I think that that's something you should be aware of. I mean, the risks on most things are not very high because most things are not around that much. But at the same time, if you happen to be the one kid to get whatever, I mean, kids die from whooping cough, kids die from pneumococcus, kids die from measles and flu. So it happens, just not very often.
Yeah, it seems like the whole system is just so outdated.
Medicine is outdated, yes.
Yeah.
Medicine is very slow to change. The world is changing much faster than medicine is, and that's a big problem.
Is that why you said like that even to get rid of glyphosate takes 20 years of suing the companies?
Yeah, well, I mean, I don't think that's medicine. I mean, it's partly medicine, but I think that's the legal system.
Yeah.
And it's also big companies, right? Because I think when you're talking about a product, whether it's a pharmaceutical company or a chemical company, they have a lot of money. So it's not very easy to get them to stop doing anything because they know how to sue. They have the best lawyers, around. And so they can, I'm sure, figure out how to prolong these things for a long time. And it's also very difficult to prove that something is dangerous. That is a very difficult thing to do. Unless something is like, oh, you take it and you die tomorrow, and everyone who takes it dies tomorrow, then that's not a very easy thing to prove to a board that like, oh, you took this product and 10 years from now you got cancer and that's the reason why you got cancer. I mean, there's so many things that happen in between and so many factors that would have to go into that. And so it's just not the easiest thing to prove. And so it takes a long time, a lot of effort and a lot of money. And who is doing that? Who is trying to take down the company that makes glyphosate or whatever? It's like there has to be an organization that gets together and lawyers and nonprofits and whatever, and they have to really focus on that topic for years to fight the company that has endless money. And then even if you do and you win, then they just make another product that's similar but slightly different, maybe worse, maybe better. So I think it's worth for us to do, but it's a very uphill battle. And that makes it very difficult. So that's, medicine, yes, it's outdated, but I think those kind of issues you're dealing with super giant corporations that have unlimited money. And so it's really difficult to fight them.
It seems like it's very hard to prove something is safe and dangerous, but also safe, like you said earlier.
Yeah, I mean, most things you don't have to prove it's safe. You just prove that it's not dangerous.
Yeah.
And that's not overly hard to do, especially if you don't look for things or, or you study something for 3 months and then you're like, oh, I guess it's safe, right? But, the problems I think the problems for a lot of things are long-term. It's not that obvious to see it right away. That's really the only things that you catch. Like, you take a medicine and you start vomiting everywhere, and a lot of people do. You're like, oh, everybody taking this medicine has a serious side effect. But other than that, if you take it and you have a problem 3 years from now, how do you know it's from that thing? I mean, it's possible to do that if you do a double-blind controlled amazing study that costs $1 billion to do that. You get 1 million people in and you follow them for 10 years. But who's doing that? And how are you doing that? And who's following these people? And it's not practical. So it makes it very difficult. And they know that.
What lifestyle changes do you do with autistic children?
I mean, the big things would be, diet, exercise. So number one, I mean, changing up their diet, usually getting the inflammatory foods, so a lot of gluten and dairy out of their diet can be really helpful. Making sure they're getting more fruits and vegetables and getting their vitamins in general, getting rid of a lot of the sugar, the processed foods. That's a big step that helps a lot. Trying to get them to move a little bit more really helps. Sometimes getting them on supplements to get their nutrient levels up. If you're going to go from an integrative perspective, then sometimes getting some testing done can be helpful. So maybe some stool testing, looking if there's any infections going on. Nutrient testing, like we said, so you can be specific to what nutrients they might be deficient in. Getting them outside more, getting them back into nature, sunlight. These are all things that seem to make a big difference. Not rocket science, though.
Yeah.
Simple stuff, but I mean, well, I don't know if you've seen this yet enough, but I mean, I certainly have with my guy. Is we eat pretty healthy, and then he goes to a party and he has a couple of bites of a piece of cake or something, and he's a completely different child for the next 3 hours or 5 hours, and that really makes you think. Like, you really have to step back and be like, look, he had one piece of cake or maybe 3 bites, and he is that wild. How much of what we're seeing in our kids' health is just the food alone, just them eating that stuff constantly, and then their brains are all over the place and they just can't focus or function. It's obviously not all that. It's not the only thing, but how much of it is actually just that? When you watch a child who doesn't eat that way just once, and you see that. So I wonder, I mean, I think it's a lot. A lot of it is actually just the food.
Yeah, and you can, I'm also always fascinated when I take him on a hike or I take him outside, how calm and peaceful his personality get. Mm-hmm. Because the cake thing, you can experience that in that way, like to worsen it, but also to soften.
Definitely. It's amazing how different they are if they get a little exercise, mm-hmm. how different they are in the rest of the day if you go on a hike or you go for a walk or you do something, you get them some sunlight. It's like, again, it's not rocket science. It's not crazy. Like, we're meant to move. We're meant to be outside. We're meant to walk around. We're meant to get sunlight. And somehow we forgot that. And we live in these isolated boxes and we're on our screens all the time and we're in our cars and we're not moving. And it should be very obvious when we look at the blue zones around the world where people live the longest and are the healthiest. They're not going to the gym every day. I mean, it's fine if you want to go to the gym, but they're just moving all day. That's their life. You know, you watch them talk to people, and it's like the grandma has bigger muscles than both of us. They're 95, and they're just like in the kitchen just rolling all day, and it's like that's just their life. They're not exercising. They're just happy. They're just moving. The people are out farming, or they're just walking up and down hills, or whatever it is. But you don't need to work out per se. You need to create a lifestyle that involves movement, and if you're just doing that all the time, then you're going to be healthy. And I think that's what we're seeing. And those people are not trying to be healthy, they're just moving.
Are you working on another book?
I will be, yeah.
Do you know what it's going to be about?
I do. I'll tell you after.
Yeah? Very cool, very cool. Is this is your first book?
It's my first book.
Amazing. Yeah. I can't wait to finish reading it. It's very cool, especially that you address, I guess, more controversial topics.
Yeah, we get into. I mean, I don't go like super hardcore into all the controversial issues. I mean, we touch on them. I think it's important to talk about it. I think it's important to touch on the topics. That way, people can kind of know what's out there. But I mean, it's not a book that's going to dive into some of these topics like in extreme depth, because that would involve like 6 other books. So, you know, it's a guide for parents to go through the big questions and help you synthesize so you're aware what information is out there. And I think that's the level that most parents who are a young parent would want. And I think that most parents wouldn't want extremely deep dives into any of these topics, because we're looking for a fun read that's kind of, you know, something you can get through in a couple of days and just get some good information that can help you to de-stress, not to increase your stress without giving you answers to things. Because the deeper you go in some of these questions, the less information you have, which is interesting. But I think, you know, in terms of the book, it's to help you to have awareness of what's out there so you decrease your stress.
Would you say that people have less children?
People definitely have fewer children these days than they used to. I mean, that's based on the data. We're going way down in children around the world, some countries by a lot.
Yeah. Are you worried about that?
I mean, a little bit. I mean, I think there are things that's going to impact in the long run, but I am not so worried about it yet. I think if the trends continue, it'll become a problem at some point. I mean, there are plenty of people, so I don't think that we're in any trouble to have enough people on the planet right now, but I think that it's important that we should be very mindful of the trends, because we need babies for the future, and I think we need people to make sure that we're always growing and we're always learning. So I think that if the trend continues, it could be a problem, but I think it's good that we're at least identifying it. So maybe I think things go up and down. So probably, you know, in 50 years, we'll be like, oh, we're having too many kids again. We need to think about going to, I don't know, who knows, right? So I think...
is there such a thing as too many kids?
I mean, I guess technically at some point, right? But not in any way that we're anywhere near at this point. You know, the world can, I guess, theoretically support only so many people. But I think if there are so many people, then we get smarter and we figure out ways to, you know, innovate or get more food or grow up or you know, maybe we'll go to another planet. I don't know. I mean, I don't think there are too many people. I think we need more innovations. That way we can expand out. So I think the decreasing is more concerning than increasing.
And also what it personally does to you. I feel like there's a lot of damage in not becoming a parent.
Yeah, I think it's something that...
Like, who would you be with not your children?
Right. I think it makes you a better person. I think it makes you invested in the world a little bit more. You get a different perspective on the world. I think it's I had this discussion. It's like, well, what are we here for if not to have kids and not to have a family and not to, kind of help impart things into the world to make the future a better place? I mean, I think that's, if you really boil it down, one of the big things of why we're here. If you want to like ask like, what's the purpose of life or whatever, I mean, you want to get philosophical, then I think that's one of the big reasons to be here. And I think that you become a different person after you have kids, for sure. And not that you're totally different, but it definitely gives you a different perspective, and I think a very good one. So, not everybody would probably be the best parents in the world, but I think it's something that we shouldn't shy away from just because we don't feel like we're ready or we don't feel like we can do it, because we really can. And that's one of the big messages too in the book is like, we can do this, nobody feels 100% ready, but everybody has always figured it out, and you don't need to know how to do everything. You watch your kids, you learn, you take in the information, you try whatever makes the most sense for your family, and if it doesn't work, you do something else. And that's what parenting is.
That's very well said. Yeah, I feel like a lot of it's just changing the focus also, and takes it away from yourself a little bit. If you're so centered on yourself and your problems, I feel like it opens you up that you do understand we're all in this together, and if you have children, you believe in the future, they say.
Right.
And it's kind of sad if you don't believe in the future,
I couldn't agree more. I think it connects us in a different way, puts it in a different perspective. And I think a lot of people, especially with all the mental health concerns that we have these days, and it gives you a different perspective, maybe a more general one, bringing us together a little bit more. And that we need a lot more of that, a lot less hate and a lot more, and a lot less division and a lot less fighting and a lot more like, does this really matter? Like, do we really need to fight about baby-led weaning versus purees? Do you really need to yell at me on Instagram? Do you really need to like stop a discussion on autism? Like, can we just talk about this? I think that gives you that perspective for some people, and then we need more of that, because the more that we are in this together, then the better it's going to be for everybody, because we're so much more similar across the world than we ever want to give ourselves credit for. And usually the fighting is about, religion or artificial lines or left and right or whatever. And at the end of the day, most people are the same. Most people agree on most things, and they might disagree on a few things, but, we're all in the same place, on the same planet. None of it really matters anyways, right? Or it all matters. I don't know. But that gives you that perspective that, like, well, why are you being so upset about this thing? Like, we have to do something for our kids, for our future, so they're healthy.
I just thought about, I'll give you two more tricky ones. What do you think about abortion?
So that is another tricky one. I mean, it's, I think that like most things in healthcare, people should be given options to make the choices that are right for them. I know the discussions. I know it's like a minefield, and I understand the other side of things too. So it's a hard place to have a specific position as a doctor here in California. I think that
does it come down again to knowing all the details of it, maybe?
I think it definitely comes down to all the details, because there are obviously specific situations that are very different than others. But I think that it's a very difficult discussion that needs to be had more without fighting, because I think that people need to discuss their opinions, and both sides of the argument are valid in many ways. And so, my opinion as a doctor, which I have to keep to here, is, people should be doing what is best for them based on what the rules are. It's a tough answer. It's a tough question. Yeah.
It is. Especially, I guess it all comes down always to education with anything, really. Because like I thought about it like this way, and then I educate myself, and then I'm like, whoa, and
Right.
a lot of people can't go back on their opinion and change it. You're so obsessed with where you're at on left spectrum, right spectrum,
Right.
so you can't even agree, even if I am liberal, I can't have a disagree with my own party. So it makes it very tricky because I don't think you can subscribe fully to just one thing. It's just more perplexed, like it's more complex, and you
Wait.
can't be in one party. I don't think it works like that.
It doesn't make any sense. Like life doesn't work that way, and parties and party lines and what is a talking point, it doesn't make any sense. I mean, so much of this stuff has such a nuanced debate and discussion, and these kind of things need to be debated and discussed by really intelligent people for 10 hours just to scratch the surface of the debate. And there are valid points to all these difficult questions that you're asking that really need to be discussed. And I think that reasonable people are going to have different answers to a lot of these things because it depends on your culture and your values and your upbringing and where you are and what the rules are. And I definitely was in one place before, and I'm definitely in a different place now on a lot of these questions. But that's just because I think it's important to be open and to kind of hear both sides, and then to have a respect for both sides. But I think that's a very difficult question right now, because both sides are kind of right on some things with that, and so it's like you take either side in the stance, and I know the other side's opinion, and I don't disagree with it.
Yeah, it's a tough one. What about surrogates?
Surrogates in what way? Do you mean like surrogates for babies?
No, do you think it's ethical or?
As in like a couple wants to have a baby and they use a surrogate to have that baby?
Or how does, as a pediatrician, how connected are you with like ethical decisions and religious decisions, I guess? And
well, I think that reasonably a doctor shouldn't be a part of those things. I think our job is not to impart our religion or our beliefs so much. I mean, I think that's obviously a part of it a little bit, but your job is to kind of give the information so that the family can use their beliefs within safe and reasonable. I mean, if someone's dying, you tell them, right? But other than that, there's a lot of middle ground for most of these things. And so I believe our job is to impart wisdom onto the family so that way they can choose what's right for them. Surrogates, I have not heard that being very controversial, so this is a new one for me, so that's interesting. But there are a lot of families that can't have kids, so I'm not sure if they want to use surrogacy, why that would be an issue. I think if you're talking about not wanting to have your own child and using somebody else to have that child just because you don't want to have your own baby, I mean, maybe there's some more ethical concerns there. But I'm not. What would be the ethical concern in terms of a surrogate from what you're asking about?
Well, me and my wife, I don't know, looking at my toddler and how connected he is to his mom is so intense that we were talking the other day, like how crazy it is to let some other woman have your baby and then take it from her after birth. Obviously, there's no studies on that and how mentally that will be for the surrogate, how she's going to feel after that. It just seems like almost like you're buying a human to have your. I mean, there's so many children that don't have parents. It seems like a very rich, absurd thing that you can have somebody else buy somebody for like 9 months.
Okay, that makes sense. I mean, I think that's a very interesting concept. I've not really thought of it exactly in that way, but there are a lot of families that can't have kids, and so that's what they choose to do and they feel like is the best solution for them. And I think if you were forcing somebody to do it, that's one thing. If someone's choosing to do it, that's another. What kind of impact that has on the child and the surrogate in the long run, I don't know the answers to that. I'm not sure that's been, I mean, maybe it's been studied, probably it has, but I would imagine, at least as of right now, the research wouldn't show that it's a huge impact. But I would think logically, I mean, any child who's been adopted or, has been through anything of that nature, certainly it affects you. So I'm sure it does to some degree. But at the same time, you would ask a lot of kids that were adopted or people had surrogates, and they would say, well, we wanted you and we wanted you so badly that we adopted you. And so that it's not always the case that they're going to be in any sort of, serious negative complications from an adoption or something like that. So I think that adoption is great. I think that's a very reasonable thing to do if there are kids that don't have parents that you can do that for. And I think that we should have kids for ourselves if we can. That's my personal belief. And I think that, choosing to do a surrogate over having it yourself, I think that doesn't make a ton of sense to me in the general sense. But I think if you can't have a child, then that isn't completely unreasonable as an option if you want. Because also for surrogates, sometimes, you can use some of your genetic DNA too, which would not be the case for an adoption. So I think there's that, there's that as well. That would potentially be sort of an incentive. So maybe like, mom can't have babies, or maybe, so then you can have the sperm, so it's still your genetics or DNA to some degree, or maybe the mom isn't able to do it, so they can still have your baby and somebody else. So I see what you're saying in terms of being controversial, but I think there is also some theoretical benefit there, because you would then be able to have a baby you couldn't have otherwise, and it's still your DNA, but you're doing it in somebody else. So it's an interesting human thing that we do, to say the least.
Yeah.
I never thought of it that way, but I think it's interesting to discuss it.
Man. All right. Maybe let everybody know where they can get your book.
Yeah, after all that fun discussion. Parenting at your child's pace. So, the Parenting at Your Child's Pace, you can get it everywhere. Amazon or parentingatyourchildspace.com. And it's a book for ages 0 to 3, great for someone who's pregnant or thinking about getting pregnant, or a young child. So thanks for having me on the show.